Welcome to Aging Insights. I'm Melissa Chalker, Deputy Director of the New Jersey Foundation for Aging. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers, the primary focus being to share important information and connect people to community-based programs. Food is something we all need to survive, though for some, accessing food can be a challenge, and with age can come changing nutritional needs. Today, we're going to talk about programs that can help individuals and families access healthy and nutritious foods. I'm joined by Adele LaTourette of the Anti-Hunger Coalition of New Jersey, and Erin and Jessica Revolorio of the Interfaith Food Pantry in Morris. They're here to talk about advocacy efforts, food programs, and nutrition supports for seniors. Welcome all to the show. Thank you so much for taking the time to be with us today. I really appreciate it so that you can share some really great information with our audience. Adele, I did want to start off with you and ask you to just remind our viewers, because you've been with us before, if you could just remind our viewers what the Anti-Hunger Coalition of New Jersey does and who you are.
So the Anti-Hunger Coalition seeks to end hunger through education, advocacy, and activism. So we work on legislative and policy fixes to any barriers to federal feeding programs. We do lots of advocacy with the emergency food community and do advocacy at both the federal and state level.
Right. And I know, preparing for the show, we talked a little bit about a lot of the things that you do, and we're going to get into maybe some advocacy stuff in a minute, but I also wanted people to understand that the Anti-Hunger Coalition New Jersey is part of something bigger, and you're also part of it's the Center for Food Action, is that right?
We're a program of the Center for Food Action, which is based in Englewood and has 8 separate emergency food sites across Bergen County. And we are their statewide program. And what we try and do is really take the issues of emergency food and people who are hungry and educate people around those issues.
And when you say emergency food, we're really talking about the services that food pantries
That's right,
provide,
food pantries
right?
and soup kitchens.
And so that enables those two organizations to have a unique relationship with food pantries. Can you tell us a little bit about that?
And that's really how the Anti-Hunger Coalition started. Was I was doing direct client advocacy work and basically walking people through the system, making sure that we had overcome any barriers to receiving assistance. And through that work, word spread around the state, and we started training other emergency food pantries how to do that. So that's how it began.
Yeah, and I know that you meet with the food pantries and you have a great network connecting with them, and a lot of the reason that you do that is to find out what the issues are that they're facing, and so that you can figure out if it's a statewide issue and if it's something that you, as the Anti-Hunger Coalition, can help them to address, right?
That's exactly right. We really try and look at, so if you're having issues with SNAP or the food stamp program, is that a county issue, or is it a state administration, a state administrative issue, or is it potentially a federal regulation that we might need to work on getting changed?
Right. And so obviously, as you've already said, advocacy is a big part of what the Anti-Hunger Coalition does. So could you tell us what are some of the, kind of advocacy focus right now that you have? Or I know that there are both state and federal things that come up. So
That's
if you
right.
have some...
So state, we have actually a hearing on college hunger. We have a bill in the state legislature to exempt veterans from a certain SNAP provision. We are working to try and get a hearing on senior hunger. I think that's a really critical piece that we need to look at more closely. And we also work on getting legislation passed for school breakfast expansion efforts. So it's trying to cover hunger in kind of all of its different forms. Child hunger, senior hunger, and everything in between.
Right. And you've mentioned a lot of great efforts, and let people know that the purpose of having these hearings is so that you can work with the policymakers, because all of the programs and services that we're going to talk about today usually come about because there is some piece of legislation that says this program should operate in this manner, and that's how the government puts these things into place. And the Anti-Hunger Coalition is kind of there to make sure that the needs that you see from working with the folks in the community get addressed in that policy way, right?
That's exactly right. We really turn to the food pantries for what is happening directly in terms of the hunger issue and what they're seeing, who they're seeing, and why they're seeing them, and then work to try and make fixes.
And so were there any federal advocacy efforts that you wanted to mention today?
Yeah, I mean, I think federally the big thing is people just watching. Nobody really knows exactly what's going to come down from the new administration. So I think everyone's paying close attention, and really we need people to be in touch with their congressperson or their senator and let them know that hunger is an issue that they need to pay attention to. That's really the biggest ask at this point.
Right. And so when you were talking about advocacy efforts, you mentioned a couple of times the SNAP program, which for people who don't know, it stands for?
Supplemental Nutrition Assistance Program.
Right, and it was formerly known as food stamps. Right. And so it's a program where people apply through their county government to receive a food stamp benefit where they can then use that at the grocery store. Can you explain a little bit about maybe some of the eligibility or how people apply and what they can use their benefit?
Eligibility is very broad ranging, so I don't even want to get it just gets very muddy. But SNAP is really the frontline defense against hunger. So what people need to do is contact their county board of social services. They can actually apply online if they want to through NJ Helps.
Right.
And that will take them through the process of applying, and then they should receive definitely word about whether or not they're eligible within 30 days. If they have emergency needs, they should go directly to the county office if they possibly can and actually meet one-on-one with a social worker.
So there are a few different ways to apply. They can go directly to their county board of social services, find out where that is, and go there in person. And then the website where they can apply is njhelps.org.
njhelps.org, that's right.
Okay, so they can go, if they have access to a computer, go on there and fill out the application. And it's going to ask them for a lot of personal information,
That's
right? To show that they're eligible. It is based on financial eligibility, right?
Yep. There's financial eligibility. There's, you have to be a citizen. So there's a bunch of different eligibility. There's, I think financial is probably the largest.
Right.
We don't no longer have an asset limit, so that's important for people to know. They can own their own homes.
Right.
They can work. It really depends on the number of people in the household. That's how the benefit levels are structured.
Right. So it's based on the your income as well as the number of people in your home.
That's
but
right.
if you own assets like a home or you have some small
or you
savings
have a car, those things don't count
those
towards
don't count.
eligibility.
Right. And I think there are some special provisions for seniors and disabled individuals in terms
There
of their
are in
application?
terms of utilities. They have a higher allotment, which really they try and get them more benefits. There's also something called the SNAS program, which New Jersey has just implemented. That is only for SSI households.
Okay.
And if you're currently receiving SNAP, you won't be eligible for SNAS until your certification period is up.
Okay, and so it's just a different way to provide the
It
SNAP?
actually provides you with more benefits. But again, it's a very small pool of seniors.
Right.
It's SSI recipients who are living by themselves. So it's really a very small pool.
Right, but it would allow them to draw down a larger
That's right, and
SNAP
significantly
benefit.
larger. Yeah.
And we should, let people know that the SNAP benefit is something, especially since we're here talking about seniors today, that's very beneficial for them in terms of getting to the supermarket and getting healthy, nutritious foods. Because a lot of times seniors go to their doctor and they have health problems that result in them needing a low sugar diet or a low sodium diet, and being able to buy those things at the supermarket, the SNAP is a huge help with that.
That's right. That's right. And New Jersey actually just got approved. We are one of 7 pilot states in the country to have people be able to order food online. Now, this won't come into existence
We should be clear. We should be clear to let people know that it's not a current program.
It's not current. It's going to take quite some time, and there's only going to be 2 vendors, one of which will be Amazon and one of which will be a ShopRite vendor.
Right.
But again, it's going to take a long time, and people will still have to pay a delivery fee, not with their SNAP benefits.
Right. So there's a program coming down the pike. We don't know when, but soon, where people who are SNAP recipients can get their food delivered from in particular ShopRite or Amazon, but there's no, all of the ins and outs of that program are not rolled out yet, and we don't know
unclear.
a lot of details, just that it's coming, right? And so people should be aware that if they are, at home and have difficulty getting to the store, that somewhere down the road we may have this program available.
It's going to be great for the
Jersey.
Senior and disabled population, but it is going to take a long time for us to
to roll it out
and work.
And see what what works best, and the trial and error of starting something new. Right? So for the older adult population in particular, sometimes there's a stigma with receiving a public benefit, and some of our older individuals might remember a time when the food stamps really were stamps that they took to the grocery store. So I think it's important to remind people that the food stamp benefit now under the SNAP program is provided in a much different way. So can you tell us how
So it's provided through what's called an EBT, or electronic benefit transfer card, which basically makes it just like a debit card, and that makes it much more inconspicuous. I think it's important that people understand that their tax dollars have funded this program, and if people need the program, they should access the program, but it is much easier to do, and just people won't know. You're just using it's like using a debit card.
Like using a debit card, so there's no fear that someone behind you in line is going to know what you're using, what you're buying your food with, and so that is a huge help for seniors who might be self-conscious about accepting a public benefit. So I think that's a great reminder. We do have with us representatives from a food pantry right here in New Jersey, in Morris County, and so I wanted to talk with both of you ladies about the services that you do provide, because you do some unique things in addition to things. So Erin, I did want to start with you. If you could just give us a little bit of information about who the Interfaith Food Pantry of Morris is and who you serve there.
Sure. So the Interfaith Food Pantry, we are a 501c3 nonprofit. And we serve families by providing supplemental monthly groceries. We were established in 1994. We started with 4 local houses of worship that consolidated their food efforts to address the issues of hunger in their community. Since then, we've had a couple different location changes, and we've really grown tremendously with the support of the community, which has increased our ability to serve clients and also the services that we can give to them as well.
Yeah, I mean, we were talking prior to sitting down here today about, just how much you can accomplish with a food pantry. People think typically I'm going to go to the food pantry and get a bag of groceries to take home, but there's so much more that in particular you're offering at the
That's
Interfaith
right.
Food Pantry. So how many different types of programs do you really run there?
We're running a lot of programs right now. Several of them fall under my hat, and I'm happy to be able to work in different departments and really see all aspects of the food pantry. One of our great programs that we have is a food nutrition program. So with a registered dietitian on staff, we're not just providing access to food, but also the education to go along with it. So we have a dietitian who works with a team of volunteers, and they run essentially a cooking show. It's a demonstration that is right before our distribution session. So before clients come in and shop for their food, they sit down in our teaching kitchen, and Katie will go through a recipe. We make sure that they're healthy, that they're fast, that they involve low-cost items, and most of the time involving things that are coming right off our shelf.
Right.
And we're really just teaching basic cooking skills, basic nutrition. Right now it's Dental Health Month, so we're talking about things that are calcium-rich that will
great.
provide, extra protection for teeth and gums and things like that.
That's great. And I know we were talking also about how you're providing some services that aren't necessarily connected to food. So sometimes you have people come in and do presentations. I know you've done a safe driving where seniors can come in and take a safe driving course at the food pantry.
Right.
And then also recently with tax season, there was availability of people to come in and get help preparing their taxes there. So, when people think about a food pantry as some place to go get assistance with food, certainly you're doing a lot of things with that, but there are also other community resources that they can get, obtain or experience at the food pantry.
Yeah, people are often surprised at all the resources that we have. Clients especially are delighted with everything that we're able to offer. We partner with a lot of community efforts and agencies. Atlantic Health comes in and brings registered nurses to help us with diabetes screenings. We are working with AARP to provide a safe driver's course. We have tax auditors from United Way during tax season that'll help prepare taxes for free.
You mentioned that people can come in and they shop for their own groceries sort of in your pantry setup, right? So they can come in and they're given some type of assessment, right, of need,
Exactly.
and then they come in and pick groceries, and they can participate in the nutrition. Is it mandatory that they participate in that class, that nutrition, or is that an optional?
It's an optional. It's definitely a highlight, and it's something that we suggest, but it's not mandatory that they participate in that. When a client comes in, we really just sit them down. Jessica's one of our client service intake managers, so she deals a lot with clients. Our clients are, one, Morris County residents, and then beyond that, it's really a case-by-case basis. So we're looking at the individual, we're looking at what their income and what their expenses are, and then based off that, their need. And if we can help them, we'll take it from there.
Right.
When they come in to shop, it's not that line up and give a bag that a lot of people assume that a food pantry looks like. We're a large facility, so we actually have what looks like a shopping area. It's a lot like a grocery store. We have aisles, we have shelves. In those shelves, we do client choice. So clients will work with a volunteer based off of their family size. That's how we determine how much food that they're able to take from each area. And then a client really chooses what they like off of each shelf. So when we come through the bean section, if they want pinto or black, that's up to them. Rye or whole wheat, same thing. So,
Right.
so we're really giving them the empowerment to choose what they're taking for the nutrition, for their preferences, and also eliminating of food waste.
Right.
When you give that pre-packed bag, what we don't know is, if they can consume those foods, if they have any kind of dietary restrictions or religious restrictions, if they like those foods. So we're making sure that they're getting the food that they really want.
Yeah, and I think that's really important, as you said, empowering them, but, coming and seeking help can be a difficult thing to do. So you're allowing them to still maintain some dignity in the process of coming in there and receiving food and receiving assistance from someone who's helping them make the best choices for their family to get through that difficult time. So I think that's really an amazing thing.
And that can be the benefit of the client choice, is having that one-on-one connection with a volunteer shopper. Bringing them through the shelves and helping them decide what they want to take. We have our nutrition educator on staff. A lot of interns from different local colleges will come and help us do nutrition education right in the shopping area. Yeah. So there's a lot of interaction between clients and volunteers that's happening.
Yeah. And I think that's a huge benefit to having the type of network that you do with your food pantry. You've obviously been in the community for a long time, so you have a network and resources that you can draw upon. So we talked to Adele a lot about the food stamp program, or SNAP, and if people come in with a need and they're not already a SNAP recipient, is that something that you try to connect them with, and so that they can receive additional help besides help from your agency?
Right now we just started a new service. We have a single stop location. They're a nonprofit organization within their own, and we are one of their host sites. Okay. So Single Stop sends representatives to our pantry, and they help screen clients for other benefits that they could be eligible for, including SNAP, heating assistance, rental assistance. All types of programs are out there that people really don't know how to navigate that system. And so we have someone who will sit down and take all of your information, put it into the database, and then it plugs it all away and sees what you could get back in benefits.
Right. Yeah, and I think that's great, because sometimes people don't know where to go. We mentioned that they can go to their county board of social services, but people might not know where that is or how to get there, or even that that's the place to go. So if they do know that there's a food pantry in their area and they show up and they need help, and you can explain to them that there are other places that they can get assistance, then that's just one more reason why what you're doing is so vital to the community. So we do want to spend some time talking about the specific senior programs that you have at the food pantry, and I know that is why one of the reasons why Jessica is with you today, because you're doing some unique things at the Interfaith Food Pantry for seniors, and one of them is home delivered meals. So I don't know which one of you wants to tackle that first program.
Well, our home delivery program works to provide the same groceries. We're bringing all of the groceries that we would be getting if the client were coming directly to our food pantry, but instead it's for homebound seniors or disabled who are having difficulty getting directly to our pantry. So we have a volunteer who knows all of their food preferences, same food,
the same shelves that the other recipients would come in and choose from.
That volunteer does the shopping for that client and then delivers it straight to their home. So we're helping to maintain their independence, keeping them in their home and making sure that they're still getting the nutrition that they need. We serve about 143 households right now, all in Morris County. So all home delivery clients are still Morris County residents. And then in addition to that, what we started about 2 years ago was our Kitchen to Table program. This program started out as a need that we saw in surveys that we gave out to home delivery clients. A lot of our clients were having difficulty preparing meals for themselves, even with all the great, nourishing foods that we were giving them. It could be difficult for them to stand for long periods of time or to, chop complete meals of vegetables and things like that. And so to kind of fit that need, we decided to start preparing meals on site in our food pantry with groups of volunteers. Those meals are then put in microwave safe containers and then frozen, and then they're easy for our volunteers to take out whenever they're needed, and then brought to a home delivery client.
Right. I think the home delivery, first of all, is a great thing that you're able to do, because sometimes for older adults or disabled population, it's difficult to get out of the house, or it's difficult to get someone to bring you to the places you need to go to, and transportation can be expensive if they need to pay for a ride or something. And so the idea that they can have a relationship with your pantry and people can bring them the food, the same food they would get if they showed up at the pantry, is great. And then the transition of taking that into helping, because you're right, if the same people who have trouble getting out of the house might have trouble actually physically preparing a meal. So the idea of turning on the stove or standing at the stove or using a knife or sometimes older adults have, arthritis or other
Right.
problems where they might have difficulty chopping or, squeezing a lemon, these sort of things. And so if someone else can prepare the food at your food pantry and use that same home delivery method of bringing the food, it's just another way that population can get the vital nutrients that they need
Right.
from food.
We just want to make sure that we're really providing a service that's of use. So it's figuring out what is of best use to the seniors that we're giving the food to.
Because you clearly had that interest in mind in doing the survey. So you were delivering these groceries, and then you did a survey to see
Right.
how that was going, and you found that people were appreciative of the food, but couldn't quite always make a meal out of what was provided to them due to other physical issues.
Yeah.
And so tell us a little bit more about how the kitchen to table works. What's the process for making the meals and getting them out, and how many go out, and that sort of thing?
It's a lot of fun.
Yeah.
So we have volunteers coming in, mostly from corporate groups. So Pfizer, Novartis, Moore Trench, different local area corporate groups will send a team, and it acts almost like a team building exercise for a lot of these departments that don't usually get to interact outside of the office.
Sure.
So they come in, we go through a food safety training. It's really important for the population that we're working with to
Right.
make sure that food safety is at the top of our priority.
Yeah.
So after that, we put on hairnets and we get cooking in the kitchen. So all of the meals are made completely from scratch. We are working with whole ingredients, a lot of kale, a lot of quinoa, things that maybe aren't too familiar to some of our clients, but we want to recreate them into a healthy way. So
Right.
we make a mac and cheese from scratch. We make the roux, we do the cheese sauce, but we roast and puree carrots and sweet potatoes and then add that into the cheese sauce. We do baked chicken fingers and we coat them in flaxseed. We recently did kale pesto for some of our whole wheat pasta. So from start to finish, it takes a few hours. It's a small team and we're working in a nice sized kitchen. And then those meals are just packed up and then
Right.
put into one of our large freezers, which makes it really convenient for us because depending on our need for that week, we don't have to worry about the food expiring. It's perfectly safe and it's kept in a freezer for convenience.
Right. That's great. And so I did want to make sure that Jessica got a chance to talk about the senior box program. Is that what it's called?
Yes.
That's the other thing that you're doing specifically for the senior population?
Yes, the Interfaith Food Pantry partnered with the Community Food Bank of New Jersey, and it was to be able to provide low-income seniors over 60 years old that are Morris County residents. Our goal was to reach senior buildings that are far in distance from the food pantry, that take them a long time to get to our pantry.
Sure.
So we're working with the social workers from these senior buildings to help us with the senior food box program.
Okay.
The participants receive a pre-packed USDA box of groceries once a month, and if we have any fruits or vegetables available, we'll provide those as well. The box contains 4 canned vegetables, 2 canned fruits, 2 cereals, 1 peanut butter, 1 rice or pasta, 1 protein, 2 shelf-stable milks, 2 juices, and a 2-pound block of cheese.
And that's something they get monthly?
Yes, monthly. And the participants must show proof of age, proof of income, and proof of residency.
Right.
So we work closely with the social workers because who better than them know the seniors in the building. And right now, we just started this program in January. And we're working on adding additional senior buildings, but currently we're working with the senior building in Mount Olive, Butler, and Madison.
That's great. That's really fantastic. And I know you wanted to mention that you're doing this in Morris County through your food pantry, but the Community Food Bank of New Jersey is doing this in other locations as well?
Right. So if there are any seniors or social workers that are interested in participating in this program, I would suggest they call the Community Food Bank, and I have the phone number.
Sure.
And it's 908-355-3663.
Okay, and they can call there and say where they live and that they are interested in the senior box
Right,
program,
and they
they'll
can
connect
get more-
them
right,
and get more
get more
information about that.
information.
That's terrific. Well, I think that the Interfaith Food Pantry sounds like you're providing a lot of great services to the residents of Morris County in general, but you really are seeking out ways to help the senior population who might specifically be struggling with how to get food into the house and how to eat in a healthy, nutritious way. So I think it's great that you're able to do all those things. But if people outside of Morris County want to connect with their food pantry, Adele, what's the best way that they can maybe locate a food pantry?
You can go
in
onto
their
our website, which is www.njahc.org. Also, you can call 211 in your county, and they might have more county-specific information. So.
Right, so those are two places where they can find out where the food pantry is in their area. We can't promise that they're doing all of the things that Interfaith Food Pantry is doing in Morris County, but they're probably doing very similar things to help the community, and it's a great place to go to get help.
It's a really good
assistance.
resource. They're great
Really,
resources
yeah,
for the community.
For the community, it's terrific. You all have provided some really great information to our guests today about how to get help, what some advocacy efforts are around food and nutrition right now in our country and in our state, and some really great inspiration, hopefully, for people out there that are providing food services in the way they can reach specifically the senior population and help them to live a healthy life. So I thank you all for doing that for us today. And thank all of you at home for sharing your time with us today. We really appreciate you viewing the Aging Insights program. It is produced again by the New Jersey Foundation for Aging and is made possible by donations to the foundation. To become a sponsor for Aging Insights programs, please go to our website at www.njfoundationforaging.org or call us in the office at 609-421-0206. All of the previous programs may be viewed on our website. And we want to remind you to find out about senior services in your area. Please contact your county office on aging. They may also know where the food pantry is in your county or in your town. Their numbers are on our website, or you can call the state hotline at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.